I remember sitting in a lecture my second year of medical school learning about a disease called tetralogy of Fallot. That's one of the basic disease processes that we deal with. It's a fairly routine condition, but at the time, never having heard of it before, it was fascinating to me that kids could grow up with something so terribly wrong with their heart, and that we had come up with ways that we could fix or at least palliate that disease condition. At the time, I was thinking about cardiology. I wasn't sure if I was interested in adult cardiology or pediatric cardiology, but I realized that in pediatrics, the disease conditions are so different from patient to patient, and when you help that patient, you can buy them another 80 or 90 years of quality life when you do that, and that really solidified my commitment to pediatric cardiology. I think it's becoming more and more important that patients become their own advocate. In pediatric cardiology, because the disease states are so complex, it's not like saying, I broke this bone in my hand, and every patient can understand that. Some of our diseases that the patients have, they don't even understand what they have sometimes. I think it's really important as a pediatric cardiologist to be an educator for patients and for families, and to spend the time with them to make them understand what it is that they have, what their condition is, what it really means for them, understand it to the extent that they could explain it to someone else, what's actually wrong with them and what they've had done. And that's really the ticket, I think, for them to become their own advocate in this process. If they don't really understand what's wrong with them even or what's been done, then it's almost impossible for them to advocate for themselves.